Hey folks, and welcome to the channel. There's a chance that many of you will be able to claim extra stimulus payments this soon. The US, for instance, has billions of dollars left in crisis relief funding to send out to many people. And after about 2 years into the crisis, Congress has already passed a total of 6 stimulus bills so far. Of 6 crisis relief bills. So far, the country has spent the majority of its available stimulus money on rescue funding. But the thing is that billions of dollars across a handful of states and a handful of categories have not been sent out yet. So, here's a chance for you to receive this extra stimulus cash. Beginning under the former president's administration and continuing through President Biden's administration, Congress has already approved $4.5 trillion in spending. Budget experts have said that it can often take some time for the total pot of funds to make its way to the American people. That's because government agencies like the SBA and the Department of Labor go through a process of legally committing to a portion of allotted funding, which is known as obligating. They then start to actually spend it. The $500 billion or so available in relief resources that have not been obligated so far may not end up being spent by agencies. There are actually deadlines for making these commitments, and they can span years. The details also vary by program. Funds that are not eventually obligated are returned for other government uses. Education, healthcare, and disaster relief are among the areas where the government has underspent in its obligated funds. The $500 billion or so available in relief resources have not been obligated and may not end up being spent by the agencies. Policymakers also have a significant share of healthcare services and funding remaining for that. According to CNBC's analysis, the government has spent nearly 2/3, or $192 billion of the roughly $303 billion obligated dollars, leaving only $100 billion to be sent out to the people in need. The good news is that extra stimulus money is coming for residents of at least 4 states all this year. States have stepped it up this year. These states will be issuing more stimulus money in some form or fashion. So first of all, California has already done this. Multiple stimulus checks were issued in the state in 2021, thanks to a budget surplus that requires state government to return the money to residents. And the same is expected to occur in 2022. The governor of California has also made it clear, very clear, that he expects to include more stimulus checks in a budget when it's revised in May. What that program will ultimately look like is anyone's guess, but if we're basing it off of 2021, the California stimulus program in 2021, then it's likely that any stimulus money issued in 2022 in this state will be aimed at helping those on low income. It also appears that another bonus may be coming for California educators as well. The 2022 state budget in Florida includes money for funding, money earmarked for their stimulus check for teachers and principals. If passed, it's worth around $1,000. Thank you again for your support. If you have any questions on the fourth stimulus check, leave them in the comments below.
Genetics, immune response, and other factors to tell which combinations of treatments are likely to work best for a particular individual. To address inequities, we can target prevention, detection, and treatment efforts so that all Americans, whether they're urban, rural, or tribal communities, have equal access to cancer diagnosis, therapeutics, clinical trials. There's so much more we can do. As I said at the beginning, this is the presidential priority. I will do my part on funding and using my authorities as president to break log jams and speed breakthroughs. I challenge and encourage all of you to continue to do your part. This will be bipartisan. This will bring the country together, and quite frankly, other nations as well. Here's some of the actions that I'm announcing today. First, I formed a new cancer cabinet, which is we will convene in the coming weeks to include members of the cabinet who are here today, all the people sitting on the stage here. They'll drive a whole of government effort to unleash every possibility within our power, within their jurisdictions. The White House Office of Science and Technology Policy, led by senior scientist and advisor Dr. Eric Lander, sitting on the end there, will chart the path for the cancer moonshot for 2022 and beyond. I'm calling on Congress to fund my proposed ARPA-H, the Advanced Research Project Agency for Health. This will be a new kind of entity within the National Institute of Health, the NIH. with autonomy and authorities to drive unprecedented progress in biomedicine. It's based on DARPA. Most everybody knows in this town what DARPA is. That's the Defense Department's Advanced Research Project Agency that has led to breakthrough technologies that protect our national security, from the internet to GPS and so much more. ARPA-H will have a singular purpose to drive breakthroughs to prevent, detect, and treat diseases including cancer, Alzheimer's, and diabetes, and other diseases. And I think there's strong bipartisan support for this. But it costs money. And these are the best dollars we could spend. So we got to get it done. We got to get it done now, not wait any longer. I'm also calling on the scientific and medical communities to bring the boldest thinking to this fight. I'm calling on the private sector to develop and test new treatments, make drugs more affordable, and share more data and knowledge that can inform the public and benefit every company's research. And I'm respectfully calling on people living with cancer and caregivers and families to keep sharing their experience and pushing for progress. You'll have a voice and a seat at the table, I promise you. And here's the one thing we can all do. America has missed more than 9 million cancer screenings in the last 2 years because of COVID, 9 million. We have to get cancer screenings back on track and make sure they're accessible to all Americans. So today I'm announcing a call to action for cancer screening and early detection. If you were supposed to get a cancer screening during the pandemic, call your primary care doctor today. If you're that doctor, talk to your patients. Get a screening scheduled, whether it's in the office, at home, or through telehealth visit. Because the Affordable Care Act now will cover most private insurance plans as well as Medicare and Medicaid to cover the recommended preventive care screening free of charge. I'm calling on companies, healthcare providers, nonprofits, and others to step up, including developing mobile units and pop-up clinics to reach people where they live. And if you're putting off screening because you're afraid of what you'll find, they'll find. Let me say this, and so many people are, put it off. Last November, I got a colon cancer screening. I'm glad I did. Trust me, I know cancer's scary. Going to the doctors can be scary. But screening is how you catch it early before it's too late. The earlier you get it, the better shot you have. Let me close with this. There's a quote that when I made one of these speeches years ago, 5, 6 years ago, was attributed